Again. Good evening, everyone. Today we are going to discuss about the features of the normas. Normas are the directions in which we view the skull. We have a direction from front that is called norma frontalis. We have lateral aspect, norma lateralis. We have superior aspect, verticalis. We have inferior aspect that is called norma basalis. And then we also have the cranial cavity. Today we are also going to talk about the bones that are present on the back, that is cervical vertebrae. We will talk about the features of the cervical vertebrae. So all these are some of the important basic things that you should know before you start about the muscle attachments. And one more thing we are going to discuss is the suboccipital triangle. There are various triangles around the neck. There is this anterior triangle, there is posterior triangle, and then there is this triangle at the back that is known as suboccipital triangle. So that is seen from the norma occipitalis. All this we are going to look at. Okay, so we'll move to the next slide. It just always takes a few seconds to sink in. All right, now this is I always want to give you one or two motivational slides or tips. First of all, you must be wondering who is my educator? Who is she? So what is her qualification and how she can motivate me? So this always comes into your mind. When the educator is qualified enough, only then you feel motivated, right? Her words should be inspiring to you. So about myself, what is the definition of an teacher actually? Teacher is the one who teaches, correct? Teacher is the one who teaches. And then you have primary school teachers, you have high school teachers, they all teach, but that is at a very young age. When you are very, very young, they are your teachers. But after that, do they know what happened to you, where you have reached in your career path? Do they come to know? No, unless you yourself go and tell them, they would not know what is your direction in which you're going to reach your goal, right? So they are the teachers. So they don't know what you're going to become in future. So they will teach you, but do they take any feedback? They would, I don't think they would take any feedback from you, or they would give you any instructions on what you want to become. So they may not influence you as much as a other person does. Who is the other person? That's an educator. So that is the difference between teacher and an educator. So educator is defined as a person who gives you overall, motivation, like your intellectual, moral, and social instructions are taken care of. So that person will influence you in such a way that you will get so influenced that probably you want to become just like her or just like him. So that is educated. So there is always a difference between just a teacher who teaches and not bothers about, what you want to become, or whether you have understood or not understood, or you are motivated or demotivated. They don't want to know. So that must be just a teacher. But when the person cares for you and wants you to become something and get inspired by them, that is educator. So we are at the level of educators because we definitely want our students to crack this exam, NEET PG, and show some results. We definitely want our students who are listening to this video to come up and then, get some seat in NEET PG so that they can make their life really smooth. Okay, let's see the other one. So now here, just to call myself an educator, I had to do all these extra hard work. What is my hard work? It takes a lot of studying, right? It takes a lot of studying as well as practicing. But it is definitely admirable goal to strive forward. So now here I have an education, both UG and PG from KMC Mangalore. And then I have also a PhD from Savita University, Chennai. And then I have done some clinical certification courses from USA. So I'm qualified sufficient to teach your competitive courses, competitive exams, and their pattern, all these things we are aware of. So all these competitive exams like USMLE, NEET, PG, and then all this MCI, FMG, all this could be easily, guided. Next, I also have a hospital administration MBA because I work for a hospital and I also look at administrative part of it. So I have an MBA in that. And then I also have a certification course in ICSI, that is in vitro fertilization, and also the ICSI, that is ART certification. And I also work as a freelancer at IVF centers. So this is my qualification, and I hope you are motivated sufficient to listen to my classes. Let's see. We have Achan. Hi, Achan. We have Shane. We have Bishop. A lot of people watching. All right, next slide. So now I call myself an educator because of the experience. I told you there are two things that is very important. One is knowledge and the other one is practice or the experience. How many years of experience do I have? So experience is very important. When you want to guide something, you should have gone through that path. Only then you can guide somebody to go in that particular path, right? So you have someone who has an experience of 10 years, both in India and abroad. So I have these many years of experience, and I believe that I can motivate you to some extent to score well in your NEET PGs. And then you have some strategies, right? Even I have some strategies. So I would call them as the SMEART goals. So what are these? What goal are you trying to accomplish and why? So I have some goals, like I want to do a lot of MCQs with you. I want to do some lot of clinical topics with you. I have to do some scenario based questions. All these are my goals, and your goal also should be something to get good extract from these kind of teachings. And then all your goals should be something that is measurable. So what is your intended outcome? So it should be something that is attainable or measurable. You cannot achieve, you cannot aim at the moon and then you feel bad and feel low and depressed later on. So you have to know your limit, and it has to be attainable. And once you know what is your limit, what is your strength, then you can easily achieve your goal without feeling low or depressed. And then, so how do we align all these things? As an educator, I would align with all these questions. First, I would teach you some basics, and then I would move on to some, core based subjects like, gross anatomy. And then I will slowly take you to the clinical based and then scenario based. This is my plan. So this is how I want to take you from a transition from a basics to scenario based questions. That's how things are done. From basic, you should be understanding the concept first. Only then you will be able to solve the questions based on the scenario. So next, time bound. What is time bound? Time bound is all the goals that you have set for yourself is time bound. So there is a limit for everything. You will have to give certain time, maybe 1 week time, 2 weeks time, 3 weeks time. What is the time that you are giving to reach your goal? Okay. Okay, so if I'm audible and clear, can you just message and type and say, yes, you can hear me? Just want to make sure that I'm audible, sufficient, and also you're able to understand what I'm trying to say. Yes. Thank you, Pakarshan, ma'am. Sometimes there is a lag period, so just wanted. Okay, next we have the slides. We talk about features of the flat bones. Now we have some features that we can talk about flat bones. What are the flat bones? Now you know that all these flat bones we are talking about is present in the cranium, right? They are present in the cranium or the cranial covering, that is called cranial vault. It's called the cranial vault. The cranial vault has got all these bones which are of two different types. One is the cancellous bone, the other one is the compact bone. So you can see compact bone here and then compact bone here, and in between that you can see cancellous bone. And they also have some perforations like this for the emissary veins to pass. So these are emissary veins. And what is this known as? That is known as diploid. Okay, that is known as diploid. So where is diploid? Diploid is present in cranial bones. It is present between the compact and the cancellous bone. Cancellous bone is in the center. On either side, there is a compact bone matter. So this is what you can see in the skull. Okay, now here you can see that there are so many sutures that is overlapping them, overlapping the bones, and sometimes they may leave out a sutural line, sometimes they may not leave out a sutural line. They may be serrated or they may be straight, or they could also be overlapping like the squamous one. The temporal bone has a squamous part that overlaps, and that is known as squamous suture. So similarly, so many bones are there and so many varieties of sutures are there. What are these sutures example for? These are example for the fibrous type of joint. So this is an example for fibrous type of joints. Okay, so this is a fixed type of joint, so it does not move. No movement. Or it does not move. You must remember this. Okay, so now here you can see there is movement of, there is suture, that is synostosis of the coronal suture. So there is early closure. So there is a early closure. Okay. This is primary craniosynostosis. Now, premature closure of some of the bones results. It could be on one side or it could be on either side. So now it could lead to some kind of deformed skull. So you can see there is a wedge-shaped skull. So this looks like a wedge-shaped skull. So it looks like some twisted or asymmetrical type of skull, and this is known as primary craniosynostosis. So primary craniosynostosis happens in the coronal or lambdoid sutures. This is something you must remember. Okay, next one. All right, we have a lot of PPTs today, so I'm going a little fast because I have lots to cover. There are two lines that you can, draw, or planes you can draw to know the symmetry of your skull. Symmetry, how do you know it is symmetry? The right side is aligned with the left side. How do you know? By knowing these two planes. One is Frankfurt plane, another one is Reed's base plane. Okay, the Frankfurt, you remember the Frankfurt airport or Frankfurt plane, something like that. It goes over the external acoustic meatus. So over the external acoustic meatus is Frankfurt. If it goes right cutting through the external acoustic meatus, it is Reed's base plane. So it passes, this also passes through the infraorbital margin and also passes through the external occipital protuberance. So this is known as Reed's base plane. The other one is known as the Frankfurt plane. Okay, now these are the different views by which you can see the or study the skull. You can study the skull by all these views. This is verticalis from top. You have frontalis. You can also see a suture that is not so common. This is called metopic suture. Okay, in this it is not there. This is normal. This is not normal. Okay, you have occipital. This is occipitalis. Norma occipitalis. You can see a triangle area that is called suboccipital muscles. You can see here. And also suboccipital triangle. Next, you can see lateralis. You can see many things. You can see those lines which are called temporal lines. Okay, basalis, you have lot of foramen which we are going to discuss briefly today. All right, first one, you can see the frontal bone here. This is called the glabella. The midpoint is known as glabella. You have two arches. This is superciliary arch. And then you have a margin that is called supraorbital margin and the foramen. So this forms roof of the orbit. What is this formed by? This is formed by squamous part of frontal bone. Squamous part of the frontal bone is this portion, that is superior margin of the bony orbit. Next, you have lateral margin of the bony orbit where you can see a tubercle. Okay, that is known as Whitnall tubercle. Okay. This is very important because the ligaments of the eyeball, because you have medial and lateral palpebral ligament. So the lateral one goes to this tubercle that is known as Whitnall tubercle. So you have four L's actually attached to this. This is the other one is Lockwood, ligament of Lockwood. So ligament of Lockwood, the lateral palpebral ligament are very important. These two ligaments are attached to Whitnall tubercle on the lateral aspect. Okay, you have inferior margin of the orbit, which you can see here, which is formed both by the maxilla and also by the zygomatic bone. Maxilla and the zygomatic bone, they form the inferior margin, as you can see here. And you also have this bony orbit, which is directed posteromedially. So it is not posteriorly, it is tilted inwards. That is posteromedially. The apex is directed posteromedially. Bony orbit. Apex is directed posteromedially. Very, very important. Okay, next you have the nasal bone. So nasal bone fractures are very common because it's a very thin plate. So nasal bone fractures are very common. You can see there is a internasal suture and this portion is covered by cartilage. Okay, the front portion, the tip of the nose is covered by elastic cartilage. So that is elastic cartilage. Covers the nose. You can see the septum also in the center, that is nasal crest or the septum. Okay, next you have infraorbital margin, supraorbital margin with the foramen. You can see that supra, infra and mental foramen, they all are in one line. They're aligned in one line. That also shows that your face is in symmetry. So by looking at or joining these lines, you'll know that none of the bones are disarticulated or moved. So you can make out that it is in articulated condition and there is no fracture when you are able to join the three foramen, supra, infra and the mental foramen. Next, you also have superior alveolar arch from the maxilla, inferior alveolar arch that is from the mandible. So this is body of the mandible. You have ramus and you have two processes. And you can see this is the maxilla. This is the body of the maxilla. You can see it has processes like it has a frontal process of the maxilla. It has the zygomatic process of the maxilla and it also has this alveolar process of the maxilla. There are three processes of maxilla. So all this you can see in the front view, which is known as Norma frontalis. I hope I'm making the things very clear to you. Okay, next one, there is one condition that you must know when it comes to Norma frontalis, that is metopic suture. So this is the suture that is supposed to close when the kid turns 8 years of age. Okay, it is supposed to close. Usually, when does the bones start ossification? About 6 to 7 weeks. Bones start. Okay, it goes on up to 25 years they grow. All right. So now this one is supposed to close by 8 years. In most of the cases, they close by 75% is closed by the time the child turns about 9 months. Okay, by this time, it is supposed to close. And it can also go on up to 8 years. This is the maximum limit. After that, if it continues to persist, then it is known as metopic suture. Persistent metopic suture could be confused or mistaken for a fracture. So that's why it is very, very important to have a knowledge on metopic suture, which is seen from the Norma frontalis. Next one, we have Norma verticalis. Norma verticalis, we have this view from top. You can see the bregma. You can see this point called the lambda, which was posterior fontanelle, which closes by 3 to 4 months. Or this one is anterior fontanelle. Okay, this closes by the time the child turns about 18 months. You must remember these two. So anterior fontanelle later on turns into bregma, and the posterior fontanelle, this point is known as lambda. So this is the two things that you are supposed to know in Norma verticalis. You can also see this, parietal foramen. You can see that is small emissary veins. You can see the superiorly. You can see the sagittal suture. You can see this is the coronal suture. This is the lambdoid suture. Is the lambdoid suture. And in the parietal bone, this ossification starts here at the parietal eminence. And it starts radiating to the corners like this. So what happens by the time the ossification is complete, the corners are the last one to complete ossification. Okay, it is the last one to complete the ossification. Hence, it gives so much of room for the growing brain. Okay, so it is going to give you so much of room for your brain to grow, because these corners are the last one to ossify and they are left as fontanelles for a very long time. Okay, let's move to the next one. Next here you have the frontal fontanelle, which is also called anterior one, and this is called the posterior one. Let's see the fetal skull. You can see the frontal bones are two separate ones. Later on, how they fused, and this is diamond shaped. And you know what this is? This is anterior fontanelle. This is a diamond shaped structure or a gap. What is this that you can see here? This is dura. Above that will be the skin. Above that will be the skin. Covering the dura mater will be the skin. So you have all the layers of the scalp. You have skin, connective tissue, aponeurosis, loose areola tissue, and pericranium. All this is present above this. Below that will be the dura mater. Okay, so that's how it looks. And this is the suture that you can see. Anterior fontanelle you can see. This is the suture. But there is a gap here right in the center. This closes at about 18 months when the baby turns to this age. So what is the importance of this one? The importance of this is when it is depressed, it will tell you that it is dehydrated. Baby is dehydrated. When it is bulged, it indicates increase in intracranial pressure. And you can also inject or withdraw blood from the superior sagittal sinus. It is easily accessible from there. So you can withdraw blood from there. So what kind of blood is that? That is venous blood. Does all these sinuses, do they have valves? They are valveless. They do not have. How do the valves function? They function because of the presence of skeletal muscles. Skeletal muscles give all these valves a push for the blood to go against the gravity. So that's how the blood moves in these veins. So now what is the difference between anterior fontanelle and posterior fontanelle is given? It's a diamond shaped one. This is a triangular one. And this is at the junction of sagittal, coronal and frontal sutures. This one is at the junction of the lambdoid suture. Okay, the lambdoid suture with the sagittal suture. And this closes by 18, this one by 6 to 12 weeks, that is about 3 to 4 months. And soft membranous floor, this is bony floor, very, very important, very, very important. It has a bony floor. This has a membranous floor. So what is the membrane we are talking about? We are talking about the dura mater. Okay. So if someone asks you whether we can withdraw the blood from the lambdoid suture, no, it's not possible. It is possible only from the anterior fontanelle. Okay, now here, this is the coronal suture. This one is coronal suture. Okay. Next one, this is lambdoid. That's the sign for lambda. So you can see the parietal eminence, you can see the frontal eminence, you can see the parietal eminence, you can see here. So all this you can identify in the verticalis. What about Norma occipitalis? Occipitalis is the view from the back side. That is from the back of skull. What you view is the Norma occipitalis. Here you can see the parietal bones and the occipital bones. And this is the lambdoid suture. And you also have a highest point here that is called external occipital protuberance. Actually, external occipital protuberance is very important because this continues with a line that is called superior nuchal line. Okay, this 5 is superior nuchal line. So this line comes down like this and then it continues downwards. And there are two things attached to this. That is trapezius muscle and ligamentum nuchae. Very important. These are the two things that are attached to external occipital protuberance. And that also extends to this area. So this is trapezius. And here it continues down as sternocleidomastoid. So sternocleidomastoid muscle also comes on the mastoid process. And there is splenius capitis. One more is longissimus capitis. So how many muscles are there on the mastoid process? There are 3 muscles. That is on the 8th one. 3 muscles are attached to the mastoid process. You also see a notch here. On this side, you can see the 7th one. That is called the mastoid notch. Okay, what is the importance of mastoid notch? Posterior belly of digastric takes insertion on the mastoid notch. That is the 7th one. What about mastoid foramen? Can you see this mastoid foramen? That is for emissary vein. It's a small foramen for the emissary vein. So that is what you can see in the picture. You can see external occipital crest. You can see this is lambda. This point is lambda. This is the suture. This is the suture. And there is lambdoid suture here. What is inion? So inion is the highest point. Okay, so inion is the highest point. And all right, there is superior nuchal line and you can see inferior nuchal line, which is the 6th one. So this area actually forms the suboccipital triangle. So suboccipital triangle is below the nuchal line. Below this superior nuchal line is suboccipital triangle. So let's see what are the different muscles that are attached to suboccipital triangle. So now you can see here the nuchal lines and you can see the lines. These are the nuchal lines. You can see this muscle. That is, this is the superior nuchal line. You can see this inferior nuchal line. You can see the attachment of muscles. There is a medial lateral, that is superomedial, superolateral, and inferior. So inferior is by obliquus capitis inferior. So this is the inferior one boundary. Superolaterally by the obliquus capitis superior. This is superolaterally. What about medially? Medially, there are two muscles. One is rectus capitis posterior minor and rectus capitis posterior major. So rectus capitis posterior major and minor, they form the superomedial boundary. So the question for your exams would be, which one forms the superomedial boundary of suboccipital triangle, or the rectus forms which boundary of the suboccipital triangle? So you must remember, rectus muscle, rectus is a straight muscle. So it is in the center. It is not an obliquely placed slant placed muscle. It's a straight muscle and it is in the center. Okay. Now coming to this content, what are the contents of this triangle? You can see this content. You can also see the cervical vertebrae. Which one is this? The cervical vertebrae, one you can see. This is C2. Okay, so you can imagine where exactly it is. It is very close to the foramen magnum. So what are the contents? What is present in this region? Let's see. You can see three things. One is suboccipital nerve, that is from the C1. Then you can see third part of the vertebral artery. There are three parts. There is a first part, there is a second part, and a third part of vertebral artery. First part, it starts from the subclavian and it ascends up to form the second part, and the third part lies in triangle, that is suboccipital triangle. So very, very important. The suboccipital triangle, whatever is there, that is third part of the vertebral artery. So many a times they have asked such question. So which part of vertebral artery lies in the suboccipital triangle? It is the third part of vertebral artery. All right, we have Shubham. Hello, Shubham. Rajeshwari. Hi, Rajeshwari. And Anchan, Prabhakar. We all have okay, we have a lot of viewers. All right, next one. If you have any questions or queries, you can message it right there. I can answer your questions, or you can follow us on some Telegram channel. You please use the drop down. You can click on the drop down there next to the link. You can see that Norma's features are there. Head and neck region is there. Next to that, my name is there. Next to that, there is a drop down. You click on this. You will get to see so many links. You'll get to see so many links. You can join the Telegram. You can give feedback on the classes. You can follow me. My code is ROHINI for YouTube classes. So you have so many classes that is there on YouTube. You can use this code. You can also go for my classes, which are special classes. So special classes also, you can see all this also has the code. So, and if you're happy with these classes, you can subscribe to Plus classes. I'll tell you how it works. You can go to my Plus subscription as well. From next month onwards, this is coming up. So right now I have all these free classes for you. That is YouTube classes and special classes. So all this can be accessed n number of times. All these videos are always there, so you can go back and check out all these videos whenever you have finished studying, before or after your revisions. You can go back and see all this and revise. So please use the code to get access to all this, that is ROHINI follow me at Row Aqua. You can download the Unacademy Learners app. First download this, then go to the NEET PG section where you will find me as Dr. Rohini, and then you follow me at this Row Aqua as well, and you can put a thumbs up there, and then you can also follow me at the profile page itself, so that you can get intimation whenever I have my classes. All these are free classes, and you will be definitely benefited. If you take plus classes, plus subscription, you will get all in-depth information about all these classes. So this is going to just give you a glimpse of what is there in Unacademy classes. So you can go for all this. If you think this is very comfortable and understandable, I suggest you go for plus subscription. Okay, let's come back to where we stopped. We stopped at suboccipital nerve, and third part of vertebral artery, I told you, it lies in the triangle. So here you can see it in the triangle. So where is the triangle? So this is the triangle. You can see this triangle on either side it is there. You can see this muscle, that is the trapezius muscle. You can see the rectus muscles. This is one, these are rectus capitis, posterior major and minor muscle. You can see medially these two. So here is the triangle. Yes, the artery is the vertebral artery. So which part? Third part. Very, very important. It lies in which triangle? The suboccipital triangle. Okay, next one. All right, so these are the things that you can see. You can see the suboccipital muscles. See how the muscles extend on to the mastoid process as well. You can see the muscle. You can see these muscles. You can see sternocleidomastoid, splenius capitis, and longissimus capitis. All these are present even on the mastoid process. Okay, so this is how they extend downwards into the mastoid process. So this is one thing that you must know. And here below this is the big foramen, that is foramen magnum. Okay, now there are very, very common bones that are present in the sutures. So to which suture it is very common? It is very common to lambdoid suture, and these are called sutural bones. And one important thing about sutural bones is they have their separate ossification center. Which ossification center? Is it primary or a secondary? They will have primary ossification center. Remember, primary ossification center is for the shaft, or it is the one which forms the body. And then there is secondary ossification center, which actually gives rise to processes. All these processes, for example, scapula has so many processes. That means what? It has secondary ossification center that are more in number. So scapula has about 7 centers. Out of that, 6 is secondary and only 1 is primary. Okay. The coracoid process also has the primary. All other things have got secondary center. So primary is for the body of the scapula. So that is one thing that everyone must remember. Next, you have external occipital protuberance. This is the external occipital protuberance. Inside that, there is internal occipital protuberance, which actually forms the confluence of sinuses. What is confluence of sinuses? That is where the transverse sinus and the straight sinus meet. Okay, this is called confluence sinus. So the superior sagittal sinus from top, the straight sinus, this is superior sagittal sinus. This is transverse sinus. So how many of them are meeting? The transverse sinus, the straight sinus, superior sagittal sinus, inferior sagittal sinus, and the straight sinus. Four of them meet, and that is known as confluence of sinus. And where is it? It is inside on the other side of the skull. So outside is external, on the inside it is called internal. So internal occipital protuberance has a point where all these sinuses they meet. Okay, so that is very, very important again. Next we have Norma lateralis. We have mastoid process, styloid process, petrous part, then tympanic part, then squamous part. So like this we have 5 parts. So what is one important lobe of brain that lies here? We have an important lobe that is called temporal lobe. Temporal lobe lies beneath this. So it has many important centers. For example, area number 22. It has area number 42. This is for the Broca's area. That is for speech. Then we have auditory. And we have limbic system. Limbic system, which stores your memory. All these are present in the temporal lobe, which is present in this region. Okay, let's see what are the attachments of mastoid process. Now here you know that this is a small projection behind the ear that is known as mastoid process, which gives attachment to this important muscle, sternocleidomastoid. So sternocleidomastoid starts pulling on the mastoid process, and by the time the baby is 2 years of age, it completes growth. So in fetal skull, this is absent. So what is the difference between fetal skull and the adult skull? The mastoid process is absent in case of fetal skull. Very, very important. So where is the sternocleidomastoid attached? It is attached to that area, but the attachment is not that strong. Hence, the baby's head, well, when the baby head turns to right or left, it is not steady. So head is not steady. Why it is not steady? Because of this sternocleidomastoid muscle, which is not very well developed and it is not holding a good grip on the mastoid process. What is the function of sternocleidomastoid? It helps you turn your head. When one muscle contracts, when one muscle contracts. When both contracts, what happens? You can lift your head. Off the pillow. So if you're sleeping on the pillow and you want to lift your head, you need your sternocleidomastoid, both the sides, the right side as well as the left side, both the sides to contract at the same time so that you can push your head forward as if you're lifting your head off the pillow. And that's very important. What is it supplied by? It is supplied by spinal accessory. It is supplied by spinal accessory now. Next one, you know what is asterion? Asterion is a point where the 3 sutures meet. There is no much surgical importance to this. So it is just a point above the supramastoid crest. So this is the supramastoid crest. It's just a junction above the supramastoid crest. There is no much surgical importance to this. Okay, so this is the branches. This is the meningeal vessels. This is anterior and this is posterior. This is anterior. Anterior one lies at this junction that is called pterion. From outside, this is the junction pterion. What is this branch? That is middle meningeal artery. So middle meningeal artery, if it ruptures, then it leads to extradural hematoma. Extradural hematoma. So this is outside the dura mater. Extradural is outside the dura mater. What about subdural? Subdural is because of the vein. And subarachnoid is because of the artery. So you must remember, extradural is because of the artery. Subdural is the only one because of the emissary veins, rupture of the emissary veins. And subarachnoid is again because of the artery. So there is artery, vein, artery. So you remember this, point, artery, vein, artery. And then this one is the styloid process. This is about 2.5 to 3 centimeters in length. Sometimes it could be more than 5 centimeters. And then it causes nuisance in the neck. It can press on the structures around it. So you have structures that is in the pharyngeal muscles are there. And the structures going to the oral cavity, tongue, hypoglossal nerve, all this. And that condition, pain in the neck, is known as Eagle's syndrome. What is Eagle syndrome? Elongated styloid process. That is known as Eagle syndrome. Okay. Do I have any questions from anyone? Okay, so far I don't see any questions. So I'm assuming that you are able to understand and you have no queries. So hit a thumbs up if you have understood and liked my classes. Okay, we'll move to the next one. That is tympanic plate. There is nothing much to tell. It is a cartilaginous rim, as you can see here, which is made up of white fibrocartilage. This is what is important. It's made up of white fibrocartilage. Later on, it turns into a bony structure. What's so special about white fibrocartilage? There is no perichondrium. There is no perichondrium in white fibrocartilage. But whereas in hyaline and elastic, you have perichondrium. That is nothing but the outermost layer. After that, you have chondrocytes. But this one, the small ones, which are the, cartilage cells, which are immature. This layer is not there. This is called perichondrium. Peri is always outside, perichondrium. So this layer is not there in case of the white fibrocartilage. And this, if it is present, it can give rise to new cells like this. And hence it is regenerative. This is regenerative. This is regenerative. Whereas the white fibrocartilage, which forms the articular disc, which forms the menisci, which forms the IV disc, all these are white fibrocartilage examples. Okay. All right, next one. So this is again the squamous part of the temporal bone. The different parts, you can see the A small tubercle, this is tubercle of the root of zygoma. Tubercle of root of zygoma, it's a very important structure for the attachment of masseter muscle. Masseter muscle attaches it. Okay, so next one. This shows you the superficial temporal pulse where you can feel the superficial temporal artery. Pulsations can be felt against your finger, that is the middle finger. You can feel the pulsations of superficial temporal artery. All right, so now this is a foramen, zygomatico-facial foramen, and artery and nerve of the same passes through this. This is the one. All right, this is about pterion. This is about 4 centimeters above the zygomatic arch. So this is about 4 centimeters distance above the arch, and see how it divides into anterior, posterior, and look at all this. And what are they supplying? They are supplying the meninges of the brain. This is the branch from the middle meningeal artery. So now you can see that middle meningeal artery is nicely looped by a nerve that is called, see, this is how the auriculotemporal nerve loops around the middle meninge. This is the middle meningeal artery. It passes through this middle meningeal artery. And this is the auriculotemporal nerve. Auriculotemporal nerve forms a loop to hold the middle meningeal artery. Very, very important. And where is this? That is just before it enters the cranium through foramen spinosum. Here, foramen spinosum. And then it enters the cranium. So before that, it forms a loop here. Auriculotemporal nerve is a branch from mandibular nerve. We'll talk more on the mandibular nerve and its branches in the upcoming classes. So that is one thing. And then this is about the styloid process. It is about 2.5 centimeters in length. It is very slender. And you can see that there are muscles and ligaments attached to it. What are the muscles? Styloglossus, stylohyoid, stylopharyngeus. See, it goes with the name. All starts with stylo. And then there is stylohyoid, stylomandibular. These ligaments are to the bones. So you have hyoid and mandible. Which two bones are present? There is hyoid bone and mandible. So one from styloid process to hyoid, one from styloid process to mandible. So these are the attachments on the styloid process, and together it is known as the apparatus, styloid apparatus. Okay. So this one shows you how the middle meningeal artery divides and how it marks on the interior of the skull. So here you can see all these markings is because of middle meningeal artery. So this is the extradural hematoma. It's outside the dura mater. That's why extradural hematoma, which is caused by the middle meningeal artery bleeding. So what is not present? You don't see the mastoid process. Here you see the mastoid process. And what about the mandible? This is also big and strong. And this is very small. You can also see the metopic suture. You can see the Norma frontalis, all the foramen you can see. Supraorbital, the mental foramen. Sorry, throat is dry. So now you can see the supraorbital, infraorbital foramen. This is the optic canal. This is supraorbital foramen. Okay, so what structures pass through that, and more details we'll see it in our MCQs, which is going to start at 9:30 today. 9:30 to 10:30. You have MCQs. We will discuss about 20 MCQs. So log in, and this is all on YouTube. So subscribe to my classes, like my classes. You will get a free reminder. You will get a reminder about my classes. You can answer the MCQs. It will be very interactive. So all these classes are very interactive. So please join in at 9:30 for the MCQs, and let's see how much you can recall with all these theories that you have studied. I'm going to stop at this point, and thanks for watching.